This is the third and final part of the parental medication administration. We talked about how to draw from all the different vials and ampules and how to mix the different medications together. We've actually looked at the landmarking that was done. Now, what I'd like to talk to you about is the different needle sizes. Remember, with the intradermal, you can take and use a 3/8 to 5/8 inch needle with an intradermal. The gauge can be anywhere from 25 and up. And the larger the number, the smaller the diameter. It's hard to get your head around that sometimes. But the higher the number, 25 gauge is a smaller diameter than an 18 gauge. So keep that in mind. With the Subcu, what you want to use is anywhere from the 5/8 inch to a 1 inch needle. And you can use anywhere from 25 gauge and up with a Subcu also. With the IM, you're going to be using 1 to 1.5 inches usually. And with that one, you're going to use anywhere from a 23 down to an 18 gauge. And keep in mind, you're always going to think about the body size, the muscle you're going to actually be injecting, and also think about the viscosity, the thickness of the medication. Okay, now what I'd like to do, we drew everything up a few minutes ago. I'd like to put it in perspective and go through the actual steps now. Okay, the first thing we want to do is look at the chart, and you're going to look at the chart to check and make sure this MAR, what's on here, is accurate with the doctor's orders. Always do that. Always check for your allergies. Look, if you're going to give a medication for pain, you want to take into a pain assessment. If we're going to give some type of medication that's going to affect the breathing or the heart rate or the blood pressure, you want to go and do vital signs before you give it. If you're going to mix medications, you want to make sure and check the compatibility of the medications that you're going to mix. Once you get all of that done, you can wash your hands, gather up your needles and syringes, come to the medicine room or the medicine cart. You would unlock the cart, you would get everything out that you need, and then we would go through the exact same process where we check everything 3 times. Check it twice before you actually give it to the patient or take it to the patient. And once in the patient's room, you would be checking it again to make sure you've got the right medication. So you do 3 checks. Don't forget to do your 5 rights. And again, that's going to be the patient, the medicine, the route, the dosage, and the time. And then the documentation is the 6th right. I've already got these drawn up, so we're going to go ahead and go into the room, and I've got them labeled. Make sure that not only do you take the syringes, but if you don't have alcohol preps in your pocket, you want to be sure and grab some alcohol preps. Gloves should be in the room because we should be wearing gloves. Okay? Now, we washed our hands before we actually started here, so we should not have to wash your hands when you actually get in the room unless you got detoured. And of course, we would never leave medication laying around anywhere. It stays with you all the time. And we checked our allergies. She's not allergic to anything I have here. Good morning.
Good morning.
How are you doing?
I'm fine. How are you?
Wonderful.
Good.
I've got some medication for you that you had requested. One's a pain medication. I understand you've had some pain in your stomach. It was rated at an 8. Is it still sharp as you described it? Okay. Well, I've got something for that. I need to check and give you a PPD for TB. Your doctor has ordered that. Okay. And then the third thing that I have is your insulin. Your sugar was a little bit high, so we're going to give you 2 units of the regular insulin. Okay? So I hate to hit you with all 3 at one time, but
that's okay.
It's worked out that way.
Okay.
Okay. All right. Let me just check your name then. Okay. And could you tell me who you are, please?
Mary Johnson.
And your date of birth, please.
It's 6/9/1945.
All right. Thank you so much. And you're only allergic to aspirin and penicillin.
Right.
Okay. Do you have a preference on which one you want first?
No, it doesn't matter. Whatever's easier for you.
Let me just kind of pull this curtain here so we can have a little bit of privacy. Okay. All right. If you want to, we'll go ahead and we'll start with your insulin.
Okay.
Okay. Just going to step around and get a pair of gloves, and I'll be right back.
Okay.
Yeah. How long has that pain been bothering you?
Oh. Well, the nurse gave me some medicine last night, and it seemed to really help, and I was able to sleep. But it just started to come back now, just a while ago.
Sorry. Maybe we'll get a handle on that and can figure out what's going on.
I sure hope so.
Yeah. Okay, this is your insulin. It's 2 units.
Okay.
And I think you've been taking it at home when you check your sugar in between.
Right. I do, yeah.
All righty. Just going to let you rest your arm across your tummy.
Okay.
There you go. And now I'm marking again for the subcu injection in the arm. I find the acromion process, I find the elbow, and it's the middle third. So anywhere in that middle third. I'm going to take my alcohol prep, start in the center, and work out 2 inches. You can lay your alcohol prep and to mark the spot because you want it to dry. You don't want to stick while it's still wet. When you pull this off, throw your cap away in the garbage can because you are not going to recap. Okay, with your bevel up, you can, if the person is large, like 2-inch pinch, I can do 2 inches or more, you can go at a 90-degree angle on a Subcu. If you do less than a 2-inch pinch, which she doesn't have a lot of a pinch at all, then I'm going to take and spread the skin and go at a 45-degree angle because there's not a lot of adipose tissue there for her. So I've got it. I'm going to count to 3 and let her know when I count to 3, you're going to feel a little sting.
Okay.
1, 2, 3. I went in, anchor it, come back, and just slowly inject it. With Subcus, we no longer have to aspirate. Okay? So now, once I get it in, I want to put counter traction on the skin, pull out the exact same way I went in. Automatically, when you pull out, this is a safety that we don't stick ourselves. Automatically push that sheath up over that needle so you don't stick yourself. Okay? Now, you should not massage insulin at all. If they're bleeding, just put a little pressure there, and it should stop immediately. And this goes in the sharps. Okay. Would you like your TB test next?
Sure, let's do that next.
Okay. All right, with this one, again, we're going to landmark. We're going to take and put a hand's breadth from the wrist, 3 finger breadths from the intercubital, and anywhere on the inner forearm here. Stay away from bruises, stay away from scars, stay away from freckles if you can, and stay away from blood vessels. And again, when you pull this off, throw it in the garbage. Okay, bevel's going to be up again. Start in the center and work out. And again, I just marked my spot with my alcohol prep. On a person, it'll dry a lot quicker than on the dummy here. Okay, now you want to go in at a 15 to a 5-degree angle, almost parallel to the skin. Put counter traction so the skin is tight. If you try to inject, see how my skin's crawling up? If I don't make it taut where the needle goes in, it's going to really hurt that patient. Okay, so make it nice and taut. I'm more about a 5-degree angle. Going to go in, and again, 1, 2, 3 a sting. Go 1/8 of an inch in, and you're just going to cover the little bevel up. You want to try to anchor it, and just slowly inject it. Okay, so that's a little wheel there. Slowly put the counter traction again and pull out in the direction you went in. Again, pull that safety shield up immediately. Okay, please do not rub this. If you rub that, you're going to rub all the medication out. Your video with Perry and Potter has you rubbing it. Do not do that. If it's bleeding, just do a little dab, but leave it be. With this, what you want to do then is take a skin pencil and just draw around it. And what you're going to do is put the day's date and that it was a PPD. Okay? And then just write it. Let her know that we'll have to come back in 48 to 72 hours to read it. Okay? All right, doing okay?
I'm doing okay.
Okay, this goes in the sharps. Okay, now let's get that pain medicine so you'll feel better.
Oh, that'll be great.
Okay. So the pain's still at about an 8, huh?
Yeah, it is.
All right. I'm going to pull this back, and I just got to do a little bit of landmarking because this is going to be your ventral gluteal. I'm going to give it here. A little educating is what I'm doing. Okay. All right. Now, with this, you want to find the greater trochanter, and you want to use the heel of your hand, not the palm. So the heel of your hand for the greater trochanter. If you can't feel it, get them to bend their leg up and down, and you can feel the greater trochanter moving. Okay? So the heel of my hand, my...
Stop. Okay. What we're going to run into is if you're pulling back and forth.
Yeah, don't stay that close on me, because I'm going to move. Don't
Right.
stay that close on
Right.
me. Okay? So I'm going to be doing just like this, pretty much. I won't step away from the bed on you. I'll stay right here. Okay?
Okay. So can we start over again?
Sure.
beginning?
Whoops. Oop, I don't mean to pinch you there. I think you rated it at an 8, right?
Yeah.
Okay. Okay. Anterior.
I actually can't see her.
I was
her
afraid of that.
bottom.
Can you go over there?
I'm going to have to move over
See
there.
her bottom.
because
Well, that's a
I
tragedy.
can't.
Okay. That's why I was saying I was afraid
with you at the foot of the bed.
Yeah.
Yeah. And you may even need to come more at it, right over there. I've got you covered, though. You're good.
Yeah,
Okay.
I trust you, Rose.
Okay.
That's definitely a bad angle. Okay,
Yeah.
here we go.
Okay. The pain's still rated at an 8.
Yeah.
Okay, I'm sorry. I'm going to go ahead and we're going to give it the injection in what we call the ventral gluteal spot. And I'm going to talk to you about what I'm doing because you're going to feel me palpating back here on your hip. Okay? Now, what I want to do is put the heel of my hand on the greater trochanter. If you can't find it, get the patient to move their leg up and down and you can palpate and feel it. So the heel of my hand is on the greater trochanter. My index finger and my thumb is pointing towards the anterior or the front. And what you're going to feel for is the anterior superior iliac spine. The second finger, or your middle finger, is going to be pointed posterior to the back. Your V in between the first and second finger should go straight up under the axillary. That gives you an indication that you got your hand in the right place. You want to palpate in that V for the iliac crest. Once you find that, you know you're in the right place. You want to clean a 2-inch margin. And I just leave my alcohol prep land there to mark my spot. On the mannequins, it's harder to dry. It doesn't dry very quick, but on a person, it'll dry very rapidly. And you want to throw your lid away because we're not going to recap. Okay, with this one, you want to go ahead and pinch up. You're going to go at a 90-degree angle, and you want to go in fast. 1, 2, 3. You okay? Mm-hmm. Okay. Tripod. See my hand, how I'm tripoding? Then aspirate. Pull back till you see a big old bubble. You don't want to see any blood coming in the syringe. If you see blood, you need to pull out. You've managed to get into a blood vessel. No blood, keep holding the syringe like I've got it here, and then slowly inject. Doing okay?
Mm-hmm. A little bit of burning.
Okay. All right. Once you get in, wait about 5 to 10 seconds, and then put counter traction, pull out. When you pull out, you can go ahead and put the alcohol prep there, but go ahead and activate your safety so you won't stick yourself. Okay. Now, don't massage. You can hold pressure there if they're bleeding, and they might bleed a little bit, but it shouldn't be a lot. How are you doing?
Oh, I'm doing okay, thanks.
Okay, great. This will go in the sharps. Now what I want to do is to take and reposition her for comfort. Would you like to go back on your back?
Sure.
Okay. There we go.
Thanks.
It should be in about 20 to 30 minutes you should start feeling relief from this. Okay? In the meantime, do you want me to put the head of your bed up or put your bed down?
Well, yeah, put my bed down, but
Okay.
no, I'll just lay flat. Thanks.
Okay. And do you want anything else on your bedside table here?
Okay. No.
The other thing you want to consider is if she wants the water pitcher, the telephone, the remote, whatever, so she won't be reaching because you just gave her a narcotic. Okay? So we've got the level of the bed down. The head's going to stay like it is because that's what she wants. Call lights back in reach. We would go ahead, wash our hands, and then go out and document.